Hi, good afternoon. It's Dr. Gary with Dental Practice Guide. The name of our company is Healthcare Practice Sales, and the website is dentalpracticeguide.com. Our phone number is 201-663-0935. 201-663-0935. We're involved in the sale of dental practices between buyer and seller, and we handle the brokerage of that. We've been doing that for 11 years. Our team consists of myself as a dentist for 25 years, two CPA accountants, a marketing director, a copywriter, a graphic artist, and 3 marketing acquisition employees. So we've been involved with the sale of dental practices nationwide for the last 11 years, and we really enjoy what we do. Our phone number is 201-663-0935. Feel free to call us. We work 363 days a year. We take off Christmas and Easter, 24/7. Be happy to give you some free advice, and it's a great market right now for sellers. Most buyers became a little bit disillusioned working as employees after the pandemic. They either lost their jobs or some of them got the hours cut, and they realized it's time to work on their dream rather than somebody else's. So we're here to help you. One of the topics today is when a private equity company buys your office, or they come to buy your office, or a DSO, how do they value it? Well, one of the base numbers they use is what they call the EBITDA, which is earnings before interest, taxes, depreciation, and amortization. They'll come up with a number. That's sort of like what the true net of your practice is, or what their net would be. So we use that formula. They have their own formula, the private equities, and they'll do a multiple of that number. That number of the EBITDA could be 3, 4, 5, 6, sometimes 7 times the EBITDA. I've seen at least as high as 9, 9.5. I've seen that. And I've also seen one that they actually paid 14 times the EBITDA. But that was a special circumstance. You rarely see that. It's really 3, 4, 5, 6, maybe 7 times the EBITDA is what your approximate norm is. And that's the formula they'll use. They're looking for practices that are grossing over 1.5 million, usually with multiple associates in it. They want the selling doctor to stay, and they want the associates to stay on. Often to the selling doctor, they'll give him an incentive to stay by putting holdback money. In other words, you won't get 100% at closing. Maybe he'll get 85%, somewhere around there, maybe 80%, maybe 90% at the closing table. The rest of that money gets held back into an account, and over the next 2 years, depending on the company, because they'll want you to stay on at least 2 years, over the next 2 years, that will be vested. Some companies, it'll be vested in their stock. And when they go to recapitalize, the money you vested in could be worth 3, 4, 5 times a multiple sometimes when they go to, recapitalize, what they call it. So you could make a fair amount of money that way. Plus, they often will pay top dollar over 100%. But it all depends on their EBITDA. And it depends on their ability to take over in that marketplace. Will a doctor stay on? Again, they hold back the doctor's money 10 to 20%, sometimes more. And they'll release it if the practice continues to maintain flat line. If it continues flat line profitability at minimum, and then, in other words, what was the dollar amounts collected and the overhead before the closing. And then you'll do quite well. When they go to sell or recapitalize, you'll be able to cash out your investment. So they use that formula. They're looking for 1.5 million and above. Generally, they'll sometimes go lower. They want the doctor to stay on for at least 2 years, and the associates also maybe longer. They'll offer medical, vision, life insurance, and a few other incentives. The average pay to the doctor as an employee will be 30 to 35% of collections is the average pay. So the doctor's going to make less money each year because he's not getting the hygiene, but he also has all the pressure off of him, and he'll probably net somewhat close to what he did before, but he won't have people working for him. He won't have associates. that are contributing, to his well-being and his financial, or he won't have his the write-offs, and he won't have the income from the hygienist. So it is a bit of a change, but then he's getting so much money up front, plus future monies, it's probably worth it. I'm believing it. And if it's a good ethical company, some of them aren't, I'll admit that. But getting back, that's how they value your company, a multiple of the EBITDA, 3, 4, 5, 6, 7 times EBITDA, sometimes higher. And you'll come in as an employee doctor, making 30 or 35% of collections, specialists sometimes more. And it's been working out quite well. I've sold quite a few of them to several doctors. All right, thank you.